I think we're going to start now. Is that all right?
Yes, ma'am.
All right. All right. Good evening and welcome, everybody. I'm sorry we couldn't have all met at the Breast Center tonight, but I assure you we've planned an informative get-together for you. My name is Jenny Douglas, and I will be your event host. You may recognize me and several other Breast Society members from our work with Komen Puget Sound. When they closed their local offices, we chose the Carol Milgard Breast Center, or CMBC, to continue our volunteer work. We are excited to be part of the newly established CMBC Breast Society and invite you all to learn tonight about the breast services available at CMBC and our society's mission to help in providing screening mammograms for underserved patients in our community. This is our first event, our first CMBC Breast Society event, and we want to find it, fight it, and keep the funding local and ask you to join us. Our program tonight will go as follows. We will start with welcome and introductions. Next, we will find it, a question and answer session with our CMBC radiologists. And then we will fight it, where you will hear awesome stories from two of our breast cancer warriors. And before we wrap it up, keep it local, where several of our CMBC Breast Society members will share their stories of how breast cancer has impacted their lives. A few housekeeping points before we begin. Please introduce yourself if you haven't already in the comment box. We are excited to have you join us. And for those of you watching virtually from Facebook, which we now have working, yippee, we are watching the comment box online and want to hear from you as well. I need to ask all of you to mute yourself. And then when you have a question, when the time comes, please remember to unmute yourself if you have a question. There will be an opportunity to ask those questions during the question and answer time with our radiologists. If you are on Facebook, our team will make sure that your questions are answered as well, and you can leave a comment with your question. Please remember, you may leave a question in the comment box at any time. Our team will be monitoring the comment box to make sure that we do not miss your questions. We also have an amazing raffle basket to award one of tonight's guests. Our team will make sure to capture everyone's name to enter you into the drawing. The winner is going to be announced on Monday. Before we introduce the CMBC radiologists, I'd like to introduce you to Leanne Noreen, Executive Director of the Carol Milgard Breast Center. Leanne?
Good evening, everyone. Hello, and thank you for joining us today. It's so nice to see those of you virtually that I know, and nice to meet those of you that are new to me. Our Breast Center is grateful to add the CMBC Breast Society to our team. This incredible group of volunteers is dedicated to raising funds to provide screening mammograms for underserved women in our community. As some of you may know, our Breast Center is a nonprofit organization dedicated to providing breast health services to everyone in our community. We are co-owned by Multicare and Virginia Mason Franciscan Health, and as a joint venture of competing hospitals, we are a unique entity in the United States. While we are owned by the hospital systems, we operate independently with our own identity, and we are not subsidized by the hospital's operating budgets. As I mentioned, we do provide financial assistance to underserved patients so that everyone can access life-saving mammography services regardless of their financial circumstances. To ensure that all patients have access, we receive support from individuals and community partners to help us fund outreach efforts and provide screening mammograms. I would also like to welcome and acknowledge that we have a few of our CMBC board members joining us today, and I thank you for your participation tonight as we start with the Breast Society. I hope you enjoy our program this evening, and thank you very much for being here.
Thanks, Leanne. Now we're going to move on to the Find It portion of our event and spend some time with the Breast Center's radiologists. I would like to welcome Dr. Forbes and Dr. O. Thank you both for joining us today. We have a few questions to review with you. For our guests joining us today, please feel free to use the comment box for your questions. We will do our best to get to them at the end of our program. Our first question is for Dr. O. Can you walk us through a day in the life of a breast radiologist for our guests who are not familiar with all a radiologist does?
Yes, I will. Thank you so much for having me on this program, Jenny. It's a pleasure to be here today. I'd like to welcome all the attendees. I'd like to shed some light on who breast radiologists are and what we actually do. A breast radiologist is a medical doctor specializing in interpreting images of the breast to diagnose breast cancer and other breast diseases. We also perform interventional breast procedures like biopsies and localizations. And how do we get to do what we do? So after 4 years of college, there's 10 years of additional education. Specifically, we have to go to medical school. And after graduating from medical school, there's a year of internship, then 4 years of radiology residency, and finally a year of breast fellowship. As everybody knows, breast cancer remains the most common non-skin cancer, the second leading cause of cancer deaths, and the leading cause of premature death in American women. And so we're very, very fortunate to have CMBC in our community. As a breast radiologist, we look at 3 different imaging modalities. Specifically, we look at mammograms, ultrasounds, and breast MRI. And out of those 3 modalities, there are 3 types of examinations. There's a screening examination, then there's a diagnostic examination, and then there's an interventional procedure. And there's some important differences between the 2 types of screening and diagnostic examinations. So what exactly is a screening mammogram? Screening mammograms are performed for women who have no signs or symptoms of breast cancer. There's no lump, there's no thickening, no focal pain, nipple or skin changes, or changes that are unexpected in the size or shape of the breast. And during a screening mammogram, 2 views of each breast are obtained by the technologist. And then from those views, there's 3D images that are reconstructed. So each breast has maybe over 100 images to interpret for each breast to see if there's any changes or anything concerning on the screening mammogram. And we actually recommend annual screening mammograms starting at the age of 40 years for the average risk woman. A yearly mammogram starting at the age of 40 yields the greatest breast cancer mortality reduction and allows diagnosis at the earliest stage and therefore better surgical options and response to chemotherapy. What is a diagnostic mammogram in comparison? A diagnostic mammogram is for women who are experiencing signs or symptoms such as lump, pain, nipple or skin changes, nipple discharge, or whose breasts have changed unexpectedly in size or shape, or to further evaluate abnormal findings seen on that screening mammogram. And often the diagnostic mammogram is followed by a targeted diagnostic ultrasound to further evaluate the area of interest. Now, the breast ultrasound, this is an examination that uses high frequency sound waves to make a computer picture of what's going on inside the breast. It can be used as a supplemental screening modality. It could be used as a diagnostic examination, or it could be used for biopsies. And then finally, with breast MRI, the breast MRI is an examination that uses radio waves and strong magnets to make very detailed pictures of the inside of the breast. And this modality can also be used for screening women who are at high risk for developing breast cancer. It can be used as a diagnostic examination when someone is newly diagnosed with breast cancer to look for additional sites of disease, and also a way to do breast biopsies. So that's what we do on a daily basis. We basically look at all these different types of examinations, mostly in a dark reading room, but we do read a lot of studies to help find cancer at an early stage.
Thank you, Dr. O. You know, that's very interesting. I was just in today having my mammogram and I had no idea the extent of all that's going on behind the scenes. So thank you so much for sharing that with us.
You're welcome.
Dr. Forbes, you have some patient images to show us today. I'll let you take it from here.
Hi, everyone. I'm Dr. Forbes. I'm another breast imaging radiologist that works at Carol Milgard Breast Center with Dr. O. This first slide is showing some examples to try to illustrate breast density. Breast density refers to the amount of fibroglandular tissue in a breast relative to fat. So in all of our breasts, they're made up of fat and this fibroglandular, or the actually hormonally active and responsive breast tissue. As you can see on the image on the left side of the screen, this is one type of breast density that we call not dense. The breast image on the right side of the screen is a type of breast density that is dense breast tissue. There are actually 4 categories with all of our research that we've come up with and our defined definitions and manuals using the atlas that we use to describe breast density on mammograms. So the 4 categories, the one on the left side of the screen is going to be almost entirely fat, whereas the breast density on the right side of the screen is the third most category, called heterogeneously dense. And these terms are just standard terms that we've come up with, and by we, I mean radiologists over the entirety of all mammograms and breast imaging in a standardized way, using all of our data from all of our clinical trials and patients we've seen in the past. And this is just one example to illustrate when we're talking about breast density, what are we talking about? And so each mammogram is assigned a category of breast density, A, B, C, D, and then that is included in our mammogram report. So basically, the new laws in our state in Washington require us to notify every patient of their breast density, and other states are also doing this in some cases. It is not required. It's not federally mandated for every state as of yet. But if you see your mammogram report or get any questions about friends' mammogram reports, this is what we're talking about when we talk about breast density. The significance of breast density is that in dense breasts, the incidence of breast cancer, specifically invasive breast cancer, is higher than in not dense breasts. And so it is one risk factor for developing breast cancer. As you could probably imagine, if we're looking for an abnormality in the breast in the image on the left side of the screen, we may be able to find it more easily than if it's hiding in the white area of the dense breast tissue in the image on the right side of the screen. There are different factors that can contribute to breast density, but basically this is what we're talking about when you get those mammogram reports. We can go to the next slide. And next slide. So these are some images from a screening patient that was seen at Carol Milgard Breast Center. And these are what we call the MLO, or medial lateral oblique images. When Dr. O was talking about our screening modality, when a patient comes in who is asymptomatic, meaning they have no problems, they're coming in for breast cancer screening, their regular yearly mammogram, we obtain 4 images. These are 2 of the images that are obtained during that exam. The other image is called a craniocaudal or CC image, but this illustrates basically an example of an abnormality that could be seen at a breast screening exam. So if we go to the next slide, we've placed an annotation on to kind of help draw everyone's eye to the area that we're looking at for the abnormality. There's an oval mass in the posterior region of this left breast. So it's the image on the right side of the screen with a red circle. And this is just one of many things that we're looking for on a screening mammogram. But just to give you an idea of one type of abnormality, a breast mass that we can see on a screening mammogram that would likely lead to additional imaging. In this case, this did lead to additional imaging. This patient's breast cancer was diagnosed here at Carol Milgard Breast Center and treated. And so there are many different things that we're looking at on screening mammograms. One really important part of screening mammograms is coming every year for your mammogram, so we can compare this year's mammogram to all of your other mammograms and look for any changes. But we're also looking for specific abnormalities, no matter if it's your first mammogram or many years down the road. And one of those things is a breast mass, like we're seeing in this case.
Very interesting information. I mean, I can see that. Are there some pictures that you see that you can't, that's not as clear?
So I tried to pick an obvious one that would kind of help you be able to see it on the Zoom. But yes, there are things that are very subtle. And as you can tell with the new 3D imaging, Dr. O touched on this a few minutes ago, but previously we only had the 2D imaging of the breast, and now we have 3D imaging of the breast called tomosynthesis is the other word you might hear for that. And that's where we take several slices of the breast and we can scroll through the breast tissue in a way we weren't able to prior to that. And so those subtle findings, little areas of pulling inside the breast tissue that might signify an abnormality like breast cancer, are very subtle and they do not project well, unfortunately, on these images. We have highly specialized monitors and computers that we actually are there. It involves it's a very involved process using physicists, which is another type of specialist who goes through a ton of different training and education to certify our monitors and all of our equipment and make sure that everything is functioning at the absolute highest maximum quality. And there's very specific standards for that. But the short answer is some things are like this, where it makes it so that even, it can be appreciated on an image like this, but there's a lot of things such as you might hear about calcifications that require additional pictures to be able to pick up and are very subtle. And the year-to-year changes can really help us identify those subtle areas. And so can the 3D or tomosynthesis images.
Wow. Okay. Well, right now, what I'm going to do is ask our viewers or our guests if anybody has any questions, and to pop those into your box so that we can have them addressed. And in the meantime, while we're waiting for those questions, I have a couple of questions to ask. So, Dr. Forbes, what can I say to my friend who thinks she's too young to get breast cancer?
So I would like to know what age your patient is, but the most important thing to know is that the recommendation currently is that at screening mammograms start at age 40 is the most common age to start screening for breast cancer. And we'll screen every year for breast cancer, no matter if this year is abnormal or not. The yearly screening will find the most breast cancers at a stage that is early. In an early stage of breast cancer, all that means is that it's going to be easier to treat. And there's a very high survival and success rate of treatment when we find very small cancers on screening mammograms. So screening mammograms are something that we're doing when you're just walking around in your normal life and you're not having any problems at all. You're not having any lumps. We're not expecting you to feel anything or have any problems with your breast. We're going to be doing our job by finding the problem before it becomes a problem evident to you. And so before age 40, there are specific situations where we would recommend screening in higher risk populations. And the best way to find out if you're in a high risk population is to talk to your primary care provider or potentially your obstetric gynecologist doctor if they're managing your breast care, and they will help you fill out a risk profile to determine if you're in the high risk category, which is a small subset of women, but it is very significant when you're in that small subset of women to start screening tests early. And oftentimes you'll be eligible for additional screening, which is another type of screening test in addition to a mammogram, most commonly a breast MRI.
Okay. A couple of questions have popped up. So Dr. O, I'm going to ask you, do mammograms expose patients to radiation?
It does expose patients to radiation, but it's very low dose radiation. It's similar to staying like in a city for a couple of days or maybe taking a cross-country airplane trip. So it's very, very low dose. We think the risk that's associated with the radiation exposure is far outweighed by the benefit that would be found if a patient were found to have an early stage breast cancer.
Okay, thank you for that. Barb Fox, do you have more questions that have popped up that I couldn't write down fast enough?
I do, Jenny, thank you. We have one here. Does having dense breasts make a person more likely to develop cancer?
So since I talked about breast density, I'll take this one. So there is a higher risk of having breast cancer develop in a breast that has dense breast tissue, but it doesn't necessarily mean that the patient will get breast cancer in their lifetime. About 1 in 8 of any woman can get breast cancer, and it's not necessarily related to genes. Genes and genetics play a very small role in the relative amount of breast cancer diagnosed. 20% or less are related to genes or genetic factors. So dense breast tissue is a factor that would increase a woman's risk of having breast cancer, but the short answer is that no, it does not tell us that they are for sure going to get a breast cancer in their lifetime. So the annual screening is going to be the first line of defense to finding any breast cancer that may or may not develop.
That genetic percentage is really surprising to me.
It surprises a lot of patients as well.
Yeah, it's very surprising. Barb, do you have any more questions?
I do. I have one from Facebook.
Okay.
Asking for definition of calcification, and is this different from dense breasts?
I could answer that question. So yes, calcifications are different from dense breasts. Again, when we talk about dense breasts, we're talking about the glandular tissue of the breast, the composition of the breast. But calcifications is actually an abnormal finding that we're seeing on the mammogram. It's like calcifications indicates that something is happening in the breast, and we want to know exactly what that is. And there's 3 reasons why there could be calcifications that show up on a mammogram in the breast. Specifically, it could be due to benign, not cancerous causes, but sometimes it could be due to precancerous causes or cancer. And we can't tell the difference oftentimes on the mammogram between the 3. So a finding of a cluster or group calcifications usually warrants a further evaluation with a needle biopsy.
Okay, thank you for that information. I have, okay, now it just flipped off my screen. Barb, are you getting the extra questions that are coming on?
Yeah, I have 2
Okay.
more. Thank you all
Okay.
for these wonderful
Yeah,
questions.
they're great questions, and I'm learning a lot. So, okay, go ahead, Barb.
So we have one, our mammograms, and Dr. Forbes, I think you touched a little bit on this, but maybe you can expand. Are mammograms effective for women with dense breasts?
So the short answer is yes, they are effective in all women, no matter the breast density. In certain subsets of women, such as women who are of high risk, as we were talking about before, or potentially in women with dense breasts, there may be a role for a screening, an adjunct screening imaging tool in addition to mammograms. So the mammogram is always going to be the first line and is going to be recommended in all women 40 and older, and in that small subset under 40 potentially if you're of high risk. But when you have dense breasts, there are potentially other screening tools we can use. MRI, I mentioned before, it's another type of test that actually involves going into a scanner and having an IV placed and having IV contrast injected. And then there's another type of test that Dr. O talked about called an ultrasound that basically we can do ultrasound screening of the breast as well if MRI is not something that a patient is able to undergo. There's several reasons why that might be the case. Those are both excellent adjunct screening tools, so meaning in addition to the mammogram, not typically used by themselves unless the patient is very young, like under 25 years of age.
Wow.
So the mammogram is going to be the number one, but in the patients with dense breasts, there can now be, a role for having an additional screening tool used annually or every year in addition to having the screening mammogram. And if a patient is concerned about that, I really implore them to talk to their primary care provider and their breast health provider, and they can help fill out that risk profile, go through their mammogram. And it actually, the risk profiles to determine your lifetime risk of breast cancer now include breast density. And when it says breast density or composition, it is talking about what we're putting in us as in the radiologist, what we're putting in our mammogram reports for you. So you can actually, if you have your own report, you can actually even go online and start to fill out your risk profile yourself, and it'll ask you your breast density. And if you don't remember, you can look at your mammogram report or ask your doctor, and you kind of just plug and play with that, and it'll spit out a number.
That's great information. Okay, so we start at 40, and when do we stop having mammograms?
So it's a difficult
There's
question.
No stop date?
So there's not a clear defined answer that has been determined to be the correct age to stop screening women for breast cancer. My best advice would be is that if you're, it depends on each patient, taking into account their functionality of daily living, their level of general health, and their willingness to have their breast cancer, if found, treated. So most commonly, if a patient is living their best life and they're still at a high level of functioning, if they can see themselves having treatment for breast cancer that could be found on a screening mammogram, and they're seeing themselves living for the next 4 to 6 years and getting treatment for breast cancer, then it is best to continue screening. If there are other factors in one's life that could make limitations for getting a breast cancer treatment difficult, or if they would not want to undergo surgery, or if it becomes very difficult mobility wise or other issues specific to each patient, that's something you could definitely discuss with your healthcare provider. And there are also alternatives in those cases that we could pursue. But short answer, there's no
No
defined
stop
age.
date.
Yeah, there's no defined age to stopping. So if you're planning on living, and if you would plan on having a breast cancer treated, then the answer is to continue your screening mammograms.
Okay, thank you. Barb, anything else?
I have, these questions are amazing and they keep coming in.
Okay.
This one I think is, I appreciate this one. Have the MRI machines improved to reduce the pounding noise? And what tools are available for someone who is claustrophobic in getting an MRI?
Wow, okay, good questions.
So the MRI machines have not improved to decrease that knocking noise. And I know we get earplugs and headphones and we try to put on music, but it's still very loud and the tube is narrow. But it's just it's the technology, again, it's those radio sound waves. And basically, and the strong magnets, and we just cannot reduce that loud noise. But as far as the claustrophobia, sometimes people opt to take a mild sedative, and that helps, you know, with the examination, and they seem to do better with the sedative.
That always works for me, I know. Barb, one more?
One more.
Okay.
Going back to the dense breast topic. It's my understanding that dense breast tissue makes it more difficult to ID a problem. If so, is there anything like diet or whatever that someone can do to make this tissue less dense? That's a great question.
I would say the short answer for the last part of the question is no. There's no dietary change or, you know, kind of quick fix to change your breast density. Unfortunately, it's kind of part of who we are, and all of us are special and all of our breasts are special, and you know, it's just part of our bodies, how they're made and what they're composed of. So there's no real way to decrease or increase your breast density. There are different factors in lifestyle or in different treatments that can increase or decrease breast density, but they're not often things that you would do unless you need to do it. There's certain treatments that you undergo or pills that you take that have different hormones or hormone suppressants that could make your breast density increase or decrease over time. If you have a significant amount of weight loss, sometimes your mammogram can look like your breasts have more basically dense breast tissue, but it's because you're losing fat. So, you know, and oftentimes that's potentially something that you're working with your doctor, and that's something that's healthy for you in the rest of your health profile. So you wouldn't necessarily want to change what you're doing with your health just to, you know, try to fix your breast density. So the short answer is no, unfortunately. And there's no real, you know, fix or medication. Oftentimes, if you're on one of those medications, you're not going to want to come off of it or to go on it if you don't need it, because it's treating a specific problem that you're having.
Okay. This was an awesome conversation, you guys. Thank you, Dr. Forbes and Dr. O, for the exceptional care that you give our patients. I'd like to tell our guests that if they want to pop their questions in the box down below, we can have your questions addressed and get that information back to you. Okay, so we all know someone who's been affected by breast cancer or has come across a strong, brave warrior or survivor. This is the Fight It portion of our program, where we will hear from breast cancer survivors and CMBC patients. Let's take a minute to watch the video together. know that video is really powerful. Getting that kind of information, the information that you have breast cancer, and then knowing that you can't afford it, it must be crippling. So I'm so glad that CMBC was there to help patients like Va and Marlis. Really important. Right now, I'd like to introduce some of our CMBC Breast Society members. This is the Keep It Local portion of our event, where we share why it is important to keep funding in our local communities. I would like to introduce Randy, Tracy, and Sue, our Breast Society members who will be sharing their stories today. Let's begin with Randy.
Hi there. My mom is my inspiration. She was diagnosed after finding a lump in her left breast in the fall of 1979, a few days before Thanksgiving. She went to the University of Washington Medical Center. She had a radical left side removal of the breast. It was followed by 7 weeks of radiation, and it was a tough time. It took a lot out of her. It caused problems with her heart and her lungs in the years to come. And she had the need for a pacemaker, which they found a way to do it on her right side at the age of 88. Although she has worried each year and faced each mammogram with lots of prayer and concern, the cancer has never returned. And each Thanksgiving, we toast to another year of life. And she is now 97 years old. She's the oldest member of our large extended family. She's the oldest elder in our Chehalis tribe. And she's humble and very shy about talking about breast cancer, but she's very strong and she's a role model to us all. So in honor of my mom and her sisters and many of our relatives and friends who have faced cancer and are not still with us today, I'm proud to join forces with Carol Milgard Breast Center, and I'm very happy to help with the outreach that's needed in our community. We have arms wide and warm hearts, and I hope many of you will join us in our efforts in the months to come. Thank you.
Thank you, Randy. Thank you very much. Tracy?
Yes, so my relationship with Carol Milgard Breast Center actually began after my breast cancer diagnosis and treatment were completed. I was now aware that the newer 3D mammogram screening was much more effective in detecting breast cancer in dense breast tissue, which I learned I had, and my present healthcare provider, I realized, didn't offer this new preferable technology. So I was determined to be as proactive as possible in preventing an occurrence in my other breast, and I wanted to access to the most up-to-date screening. So the search for this technology actually led me to Carol Milgard. Carol Milgard continues to be my peace of mind, my lifeline since my 2013 diagnosis and treatment. They have graciously screened me since 2014, and for those first 5 years from diagnosis, I was given what I like to call cancer perks, or that extra care and attention treatment. Instead of waiting for results via mail or a phone call in a few weeks, I was told within a few hours. If a concern presented itself, I would be sent upstairs for an ultrasound that day, instead of the usual wait for a week and then set up that appointment and wait some more. I remember having to have an ultrasound after one screening and was greatly relieved to have it all okay within a few hours of my initial visit. I was thankful to have these results so quickly. CMBC was able to administer and assess the screening and ultrasound that same day. I wish all mammogram screenings were given in this timely and efficient manner. CMBC delivers in so many vital areas of patient care. The state-of-the-art technology, the privacy lockers and changing stations, as well as those comfy spa robes that you get to wear while you're waiting for your exam. Serene waiting areas, and most importantly, the competent caring staff, highly qualified technicians, nurses, and doctors. I'm so thankful that CMBC is here for us in the Puget Sound region. I'm honored to assist in their fundraising, outreach, and education endeavors in our community. Thank you.
Thank you, Tracy. Thanks a lot for sharing that. And Sue.
Hi.
Hi.
I wanted to just start out briefly to say, along with teammates in this, a welcome and thank you to all of you who are here with us. My story is a little different, but it's the same. And even looking at seeing Dr. O and Dr. Forbes going over those slides, just hearing about breast cancer, excuse me, just grabs me in the stomach, having gone through it. For me, it's been 20 years this December that I had breast cancer, and I am part of the Grateful Club. And I want to talk to you just a minute about the Grateful Club. The Grateful Club evolved for me as a personal title of a club that evolved because when you go through cancer, as you all know, and many of you have gone through it, you're a survivor. But somehow for me, when I looked at the disparity that was out there of women like the slides that we just saw, those precious women, those precious families, that they did not come in and get the early detection, maybe not necessarily for them, but those that are in minorities, Black, African-American, those that are coming from, now we're getting, people from, women from all over the world that are coming into the Northwest. So my heart went out to them because I had the benefit of family, faith, friends, early detection, excellent medical care. So what I realized, and even underscored with those slides, is women are terrified about coming in they're fearful of what's going to be found. So they don't want to even come in the doors of Carol Milgard. But really what we all know, and even more educated by these wonderful radiologists, it's way more important what can be found. And early detection is so major. As a side note, because of COVID, so many women have put off their mammograms. And now, you can Google that. Source after source of physicians across the country will talk about the fact that they're so concerned about an onslaught of advanced cases because women did not come in early enough. So this is where you folks come in, because my heart is labeling this amazing place of Carol Milgard Breast Center as the Grateful Club. I want to grow this Grateful Club. We have everything there to do it. And the slate is open. The slate is wide open. The possibilities are endless for men, for women, for creative ideas, for raising funds, for getting people involved so that we can enlarge the donation bank for women who come through that door. So we'd love the reputation, wouldn't we, out there that, oh, they'll help, you can come in. You can come in, they'll take good care of you. It's a state of the art, and they'll help you pay for it. So for women who are putting themselves at the bottom of the pile because of their own needs, because of the family bills, we want to get those people in the door. So would you help us? Would you help us enlarge this club and bring people right through the door? And so I'm excited about the results for tonight. I think that this is just the beginning of some wonderful ways that we as a community can come alongside and support this great place. Thanks.
Thank you, Randy, Tracy, and Sue. We have been sisters in this effort a long, long time. And I'm so very proud of you for sharing these emotional stories. It's important information for us to have, and we are ready to welcome everybody's help to get early detection paid for. There are a couple of other things that we wanted to share with you about CMBC. CMBC is actually a breast imaging and diagnostic center. It's important to recognize that they are not a cancer treatment or research center. CMBC focuses on detecting breast cancer at its earliest stage. They provide financial assistance for underserved patients to make sure that there is no financial barrier to receive life-saving breast health services. We know that women whose breast cancer is detected at an early stage have a 93% or higher survival rate in the first 5 years. That's why we have chosen to work with CMBC. We are grateful that you've joined us today. And as Breast Society members, we are excited to partner with CMBC to provide screening mammograms to underserved patients in our community. We have seen organizations change their focus from local to national and feel it is important, extra important, that we keep funding local to support our neighbors, friends, and loved ones. We've asked you all here today so that you can learn more about the Breast Center, the work they do, and to join us in supporting their mission work. If you are interested in serving on the Breast Society, please make sure to leave your name, email, and contact phone in the comments, and our team will reach out to you following this event. Does anyone have any questions at this point? Please put them in the box, and Barb, if you see any fly by, will you let me know?
I sure will, Jenny.
Okay. All right. Well, I'm going to move on, and we can direct questions. We'll get answers to people who put questions in the box. We'll get back to them later. An interesting fact for you to know is that a mammogram today costs $425. This cost does change year to year. What our work will focus on is raising the money to cover that cost for the underserved in our community so that everyone can receive this early life-saving detection. This is important work. And as we bring our event to a close, we would like to extend our appreciation to everyone joining us today. Today was about introducing you to CMBC and the Breast Society. We hope you can join us for our inaugural spring tea planned for May 14th at the Tacoma Country and Golf Club. For questions we did not get answered, please leave your contact information in the comment box or reach out to Barb and we will make sure to follow up, because if it's an important question to you, we want to get you the answer. Most important, if you're interested in serving on the CMBC Breast Society with us, please contact me, Jenny Douglas, at comcast.net. Finally, thank you to our raffle basket sponsors, CMBC Breast Society, radiologists, and staff for making this event possible. Again, we will announce the winner of our raffle basket on Monday, so we are sure to have captured all your names before a winner is selected. Barb Fox from CMBC, are you waving, Barb? Will be contacting the winner with pickup details. For more information and to hear about future events, please visit www.cmbcbreastsociety.org. Again, that's the cmbcbreastsociety.org. Don't forget to follow Carol Milgard Breast Center on Facebook to hear about all the great work they are doing for underserved patients. And have a great evening, everyone. Good night.